In this video, we discuss supportive oligonucleotide therapy, SOT, as a cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. There are many genes that drive cancer called oncogenes. Some control cellular proliferation, and some prevent the apoptosis, self-destruction, of cancer cells. Genes are expressed by messenger RNA, mRNA. Antisense therapy uses oligonucleotides, short strands of DNA or RNA, to attach to mRNA, switching the gene on or off. Antisense has proven to be a very promising therapeutic tool. There are currently 15 FDA-approved antisense drugs on the market for indications as diverse as Duchenne muscular dystrophy to hepatitis B. In 2021, there were a total of 229 clinical trials investigating 60 oligonucleotide oncology drugs registered on clinicaltrials.gov. However, no antisense drugs have been FDA approved for the treatment of cancer yet. Antisense oncology drugs have made it to phase 3 trials 5 times. One in prostate cancer did not produce any significant benefit in outcomes. Neither did another in multiple myeloma, nor melanoma, nor acute myeloid leukemia, AML. But one phase 3 trial for the drug Genesense did produce statistically significant survival benefits in chronic lymphocytic leukemia, CLL. The trial showed that Genesense paired with standard of care patients produced a statistically significant increase in progression-free survival of 51% compared to standard of care alone. It also led to a median survival of 274 days, compared with 238 days for standard of care alone, and a response rate of 11.7% compared to 6.8% for standard of care alone. Yet the drug was not approved because although the improvement in progression-free survival was statistically significant, the improvement in overall survival was not. However, in patients who did achieve a complete remission, the duration was significantly longer with the addition of Genesense 36 months versus 22 months. It is important to note that overall survival, not progression-free survival, was the designated endpoint of the study, the metric that would determine whether the drug would get approval or not. The FDA's rejection of Genesense garnered criticism from many onlookers, with one online magazine writing, "The FDA review process has become an increasingly tangled web of data, assertions, and upset." Many healthcare professionals feel that the drug warrants approval and that the FDA's treatment of Genesense has been too harsh. The FDA acknowledged that progression-free survival is a valid endpoint to measure, and statistically significant improvements in it could be enough to garner approval for a drug. But because that was not the predetermined endpoint for the study, Genesense would not gain approval. One option does exist for patients wanting to take advantage of antisense therapy, and that is supportive oligonucleotide therapy, SOT, from the company RGCC, based in Switzerland. A vial of blood is drawn from the patient at an affiliated site, which can be in the US or in any number of countries. The blood is then shipped to RGCC's lab in Greece, and a personalized antisense therapy is produced based on the blood analysis. There have not been clinical trials conducted on this therapeutic, but scientists at RGCC did publish a survey in a peer-reviewed journal of 95 patients who had received SOT. Over 80% of the respondents had a solid tumor, and SOT was taken with a variety of cancer treatments. The survey stated that 5% of patients reported a complete response, 42% reported a partial response, 6% reported a minor response, and 24% reported stable disease for a disease control rate of 77%. SOT has been used with reported positive results in several U.S. integrative clinics, such as the Center for New Medicine, for nearly a decade. For more information about SOT, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.